What causes sciatica? That burning, pulling, aching, or that electric shock down your leg. It sucks, and we don't want to deal with it anymore, but what the heck is causing it? My name is Dr. Grant Elliott, and we have helped thousands of people around the world fully recover from sciatica through our one-on-one online coaching program. And in this episode, number 125 of the Low Back Pain Podcast, I'm going to explain the 3 most common reasons for sciatica. Real quick, if you have not joined my private Facebook group yet, you need to do so. It is called RehabFix Low Back Program. And immediately upon joining, you will receive our free step-by-step sciatica guide. This is the same process that we have taken thousands of our clients through around the world to identify exactly how to fix their sciatica and ultimately become pain-free through our one-on-one coaching program. In this group, you will be able to see our clients and what they're doing for success and additional resources and more free guides. So if you're serious about fixing your back, you need to join this group, RehabFix Low Back Program. See you soon. Now, what is causing your sciatica? The number one and most common reason for sciatica is a disc herniation. Your disc has herniated or protruded. It is putting direct mechanical pressure on the nerve root that exits your spine and is creating those symptoms to shoot down the leg. Whether those symptoms are a burning sensation, a numbness and tingling, a pulling sensation, or an electric shock, these are various symptoms that many individuals can feel when that disc is pushing directly on that nerve root. The way this type of condition is resolved is by removing that pressure from the nerve. So by identifying the right low back exercises for that type of disc herniation, which is what we do with all of our clients, we can effectively move the disc and move the spine in a way that reduces that pressure off the nerve, reduces pain and sensitivity down the leg, and we can see immediate improvement in range of motion and pain. Most of the time, these types of disc herniations behave in a few different ways. Most individuals will notice that sitting long periods increases their back pain or leg pain. Bending over to put like socks and shoes on in the morning or things like that, or stretching their hamstring will increase this pain. And also, if they've been sitting for long periods and they go to stand up, they will notice it is tight or stiff to stand up straight initially. These are very common symptoms that might tell us the reason for your sciatica is because of a disc herniation. These are the most common symptoms that most of our clients have, and this is what we treat the most. The second common cause of sciatica is localized nerve root inflammation or irritation. Yes, a disc can directly push on a nerve root and cause those symptoms. However, in other nerve root-based conditions, we can actually have a localized inflammatory environment around that nerve root that is causing the pain, sensitivity, and tension. The nerve root is just a little bit upset and there's some inflammation around it. There's these nasty chemical mediators that are causing the sensitivity there. For these types of conditions, what we find works best with all of our online clients is that mobilization and desensitizing movements focused on opening up the area around the nerve and letting it breathe and letting it relax and improving blood flow to this region is what is going to help these kinds of conditions the most. For individuals with this type of condition, they might not find that sitting long periods makes it worse or that bending forward is limited. For a lot of these individuals, they have decent range of motion. They can bend forward a relatively decent amount or sit a relatively decent amount of time. It is not a significant trigger, but they could still have a lot of sciatica down the leg. That would be this type of nerve root focused condition that we also see a lot. Quick interruption. If you're listening to this podcast and you're resonating with the things that I'm saying and you're finally ready to be pain-free and you don't have a plan and you're not sure how to get there and you're just looking for that guidance, then visit the link in the description or the show notes below. You can schedule a free initial call with my team and we will actually go over your current regimen, go over what you should be doing, what you should not be doing, and how a better plan might potentially show you how to get to that pain-free state that you've been looking for so that you can get this over with and back to living your life. So if you're ready to finally figure this out, then visit the link below, schedule a call with us. Looking forward to helping you. Back to the show. And the third and final most common reason for sciatica is stenosis. Now, stenosis simply means a narrowing, but there are 2 types of stenosis that typically cause sciatica. Stenosis is most common in individuals who are 65 years of age and older, so it is most common in a geriatric population, and it is a result of bony growth. The two areas that are susceptible to bony growth that can cause sciatica are the IVF, the intervertebral foramen, and the central canal. The intervertebral foramen is where each individual nerve root exits the spine. If this opening is narrowed, it will cut off space to that nerve root, can cause direct impact or compression to it, or can simply reduce that space so that the nerve root cannot move as well and create symptoms down the leg. Now, for the second type of stenosis, the central canal is the canal in which the spinal cord goes through. So if this canal narrows due to bone growth, then that is what will cause sciatica down the leg, direct encroachment on the spinal cord. The difference between these two conditions is that with IVF stenosis, the individual will feel the symptoms down one leg, where if they have central canal stenosis, they will experience symptoms down both legs, most commonly. With stenosis, the most common presentation is a preference for flexion. So sitting will feel good and will relieve symptoms. There's actually something called a shopping cart sign, where individuals who are of age and who are suffering with this, when they're shopping, they might lean on the grocery cart in front of them as to promote a flexed or rounded posture to take pressure off of their spinal cord or nerve. For these individuals, a combination of flexion, core, and many times extension-based movements at the right time will be the solution for these individuals. Because remember, we don't want to treat everybody based on a textbook or a picture. That is simply not how it works. And what we tend to find is that even with some of our stenosis patients, they do respond to exercises that were deemed not appropriate for stenosis on a textbook or by previous providers because they were not taken through a thorough evaluation and their program was not designed based on symptom response. It wasn't designed based on results. And that's the best way to assess an individual, is based on results and based on an assessment. So if you are suffering with sciatica and you resonated with one of these three options, comment below the option that you feel you might be dealing with. And also check the description box, because I will personally put 3 different videos and exercises linked to help each one of these reasons for sciatica. And of course, join our free Facebook group so that you can get our free step-by-step sciatica guide and learn more about how we could help you fully recover from this particular condition. You can get better. You can resolve this. You just need to be willing to take that step, commit to a solution, accept guidance, and realize that you might not be able to do this on your own. And that is exactly why we are here, to help individuals like yourself around the world find a real, fast solution that will last, because you learned how to fix yourself. You learned how to take control of yourself. You learned how to be in charge. So you're not relying on machines and other people to do the work for you, which will result in you just simply coming back for months or years to come. Let's put you in charge. Let's get you pain-free. Let's put you in the driver's seat. If you are watching this on YouTube, please like, comment, and subscribe. If you are listening on your favorite podcast platform, please leave a 5-star rating and review so we can grow this podcast and help reach more individuals who deserve to get results, who feel like they're spinning their tires and getting frustrated in doing so. As always, move more, move in nature, move in the sun. Thank you so much for listening, and have a great day.